is Dr. Paul Firnhaber. It's time for another edition of 10 Minutes of Truth. So as you know, on Wednesdays, for about 6 to 12 minutes, we explore the science behind health and health research and the applications of health in the chiropractic clinic. So today, I found several articles while researching for a patient of mine that I thought were very interesting and very, very important. And as you know, I've talked a lot in the past about the importance of our GI tract and gut health and the health of our microbiome. So the first article that I want to talk about today is an article out of the International Journal of Molecular Science. This is 2023 of August. So we're looking at, about 2.5 years ago. And the name of this article is Targeting the Gut-Eye Axis, an Emerging Strategy to Face Ocular Diseases. I'm just going to read some things out of the abstract here. It says the human microbiota refers to a large variety of microorganisms, bacteria, virus, and fungi that live in different human body sites, including the gut, the oral cavity, the skin, and the eyes. In particular, the presence of an ocular surface microbiota, which means the bacteria and gut, the flora around the eye, they have a crucial role in maintaining ocular surface homeostasis by preventing colonization from pathogen species, has been recently demonstrated. Moreover, recent studies underlie a potential association between the gut microbiota and ocular health. In other words, there's this gut-eye connection. So if the gut microbiome is not functioning well, that's going to affect our eye health. And when you think about it, how many little kids have to have glasses early on? And, what are they eating, when you think about it? It says, therefore, understanding the link between the gut microbiota or microbiota and these ocular disorders might be useful for the development of new therapeutic approaches such as probiotics, prebiotics, symbiotics, or fecal microbiota transplantation, through which the gut microbiome could be modulated, thus allowing better management of these diseases. Very, very interesting. Here's another article. This is out of the Annals of Medicine, Influence of Gut Microbiota on Eye Diseases, an overview. I'm just going to read again out of the abstract. The microbiota is a dynamic ecosystem that plays a major role in host health. Numerous studies have reported that alterations in the intestinal microbiota, which we commonly refer to as dysbiosis, may contribute to the pathogenesis of various common diseases, such as diabetes, neuropsychiatric diseases, and cancer. Now that's interesting. How many physicians treat those diseases by treating the gut? Not many that I know. However, emerging findings also suggest the existence of a gut-eye axis wherein gut dysbiosis may be a crucial factor influencing the onset and progression of multiple ocular diseases, including uveitis, dry eye, macular degeneration, and glaucoma. Let's look at article number 3. This is out of the Journal of Clinical Medicine, 2024. The name of this article is From Gut to Eye, Exploring the Role of Microbiome Imbalance in Ocular Diseases. So, the gut microbiome plays a crucial role in human health, and recent research has highlighted its potential impact on ocular health through the gut-eye axis. The gut microbiota influences ocular health through immune modulation, maintenance of the blood-retinal barrier, which is very interesting. We've heard about the blood-brain barrier. the blood placental barrier. Now it's the blood retinal barrier, and production of beneficial metabolites. Dysbiosis can disrupt these mechanisms, contributing to ocular inflammation, tissue damage, disease progression in conditions such as uveitis, age-related macular degeneration, diabetic neuropathy, dry eye diseases, and glaucoma. Therapeutic modulation of the gut microbiome through probiotics, prebiotics, symbiotics, and fecal microbiota transplantation shows promise in preclinical and preliminary human studies. So these are 3 scientific articles out of respected and good journals that talk about this gut-eye axis. So here's what I'm saying. Probably a lot of you out there have eye issues that are maybe a problem for you. Maybe you should get your gut checked out. Maybe you should get some testing done and find out, do you have a gut issue? Now, at the very least, if you didn't do that, you could at least start feeding your gut so your bacteria could grow healthy. Well, how do you do that? Number one is be eating fermented foods, like, some organic sauerkraut would be really good. Kimchi, kombucha tea, organic kefir that's not loaded with sugar, because we know that sugar is a great disruptor of the microbiome. Okay, so just eating fermented foods would be a good way to start out. But if that doesn't work, and feeding your gut like with good solid vegetables like broccoli, cauliflower, kale, romaine lettuce, Brussels sprouts, okra, lots of good fruits and vegetables really help feed your gut and your gut bacteria. But it's possible you may need some testing done and a more, what I would call, comprehensive gut healing protocol. So those are some things we do here at the Lincoln Disc and Nutrition Center. I would recommend first, before you do anything, you change your diet and start eating fermented foods. That'd be a good place to start. And if you have some eye problems, it's quite possible that part of this may be coming from your gut, maybe a lot of it. And you really need to take a hard look at your diet, and the science is beginning to show that. So if you have any questions regarding these issues, please come in and we can talk about it. The way that I found these articles, I was doing some research for one of my patients, and just looking at what we could find with her, because she had some unexplained eye issues that were going on. And so there are lots of different alternative and natural strategies that can get you well, that can help you from a variety of diseases and a variety of symptoms. So that is exactly what we want to do here at Lincoln Disc and Nutrition. Now, next Tuesday, we have a talk on the role of posture in health. This is an incredibly important talk. A lot of information that probably most of you don't know or never heard of. Very, very scientific, and a lot of good science behind what I'm going to be talking about next week. So that talk next week will be Tuesday night at 6:30, from 6:30 to 7. So we hope to see you there. That's in our office. All of my talks are free. They're no charge. We'd love to have you there. And again, if you have any questions, contact our office at 402-488-2220. I hope you have a great day. I hope you evaluate your diets and start eating healthy. I'll see you next week.